You're listening to Consumer Choice Radio. We're speaking with Dr. Henry Miller. You can follow him on Twitter at Henry I. Miller, and we'll also link to some of his articles. Another one that we came across has to do with smarter approaches to health. It seems as if we've been in a constant conversation the past year about best practices for health. A lot of people have gotten all kinds of top-down information, but you actually put forward in this article that there are ways that people can improve their public health actually at home with something as simple as sugar-free chewing gum, not just the mask, not just avoiding indoor crowds, but actually chewing on something would make us feel better. Could you explain that a little bit?
Yeah, the article that you're alluding to was part of an analysis of the ways that we can address the coronavirus pandemic. So there are areas of personal responsibility and shared responsibility and government intervention. And so personal responsibilities are such things as physical distancing, wearing masks, avoiding crowds in indoor venues, and so on that we can do as individuals. And then there are shared responsibilities such as schools or businesses having adequate ventilation in order that air is circulated and dilutes out any virus that might be present and dilutes it to a less than infectious dose. And then there are things that, of course, the government can do, such as instituting testing and contact tracing, and then the more heavy-handed interventions like lockdowns and so on. One of the unobvious, for me at least, until I began to look into this, one of the really unobvious individual interventions that seems to have promise is chewing sugar-free gum. Now, how could that be? Well, there are several ways. Chewing gum elicits saliva production, and saliva has both antiviral and antibacterial properties. And aside from the antiviral properties, because we don't know yet whether it has activity against SARS-CoV-2, it certainly has antibacterial properties, which prevents dental caries, that is, cavities. And by doing that, we reduce the incidence of gum disease and other things, which is particularly important during a time when many people have neglected regular dental checkups and dental care. So that's one way that chewing gum is beneficial. Another way is, and this is perhaps even less obvious, the lockdown imposed isolation and anxiety over the past 14 or 15 months has caused many people to be depressed. And all of this, the isolation, the anxiety, the depression, erode the body's natural immune system. And an ingenious controlled clinical trial that was performed some years ago found, quote, gum chewing had consistent positive effects on mood during acute laboratory stressor. The subjects that's end quote. The subjects who chewed gum, quote, had significant better alertness and reduced anxiety, stress, and salivary cortisol, end quote. Cortisol is a stress hormone. And also, the gum chewers, as opposed to controls, did better on multitasking tests known to evoke stress. So, in a sense, it brings new meaning to the cliche about walking and chewing gum at the same time. In other words, people who were chewing gum were better able to walk than those who were not chewing gum. So there are a lot of simple things that can be done, including chewing of gum, which is cheap and readily available, and also for many of us pleasant as well.
Oh, it's super, super interesting. I mean, who would have thought that something so simple could actually have such an impact? Now, we do have to go to commercial, but we'd love to chat with you for our next segment as well to build on that and some of the other regulatory questions if you don't mind joining us after the break.
I'd be delighted to.